Good morning, Dr. Roger.
Good morning, Shankar. How are you?
Good. I should actually tell you good afternoon because I am currently in Amsterdam, Netherlands. And
Awesome.
but I didn't want to miss this opportunity to talk and educate our viewers online. And today you have a very interesting topic, the disconnect between the company, health plan, and doctors. And
Right.
it's a very important and interesting topic because first of all, I want to understand why is there a disconnect and why do most employers and also employees assume that there is a connection.
That's right. It's a good question, and it it's a very subtle disconnect. How many? I mean, if you're an employer, you're always thinking of providing a healthcare benefit for your employees, right? But what you're really working so hard to put in place, and we work with HR directors and whatnot. They work really hard to put that in place to cover uh, the employees with insurance. So now insurance is not a connection to a doctor, So there is the disconnect, and I say it's subtle because in the world that we live in, whenever anybody is talking about health care, most of the time, if you see that in the media or in your company, they're talking about health insurance. And so we at Direct Med Clinic, we are always talking about healthcare, meaning what the service that a doctor provides to a person, you know, doctor to patient or company or clinic to company. Um, so that's why we call it Direct Med Clinic. We not only focus on this direct doctor patient relationship. In fact, our mission, vision, value statement talks about restoring that relationship. But we also reach out to companies as a clinic and
Mhm.
provide this affordable access to a doctor through that direct relationship.
So that's really interesting. Then, if the doctor is not connected to the to the company via insurance, then it. I think it deserves the question. Well, then to whom is insurance connected?
I think
Because
I think I know what you're trying to say, but really it makes total sense to any business owner that your loyalty and your services are going to go to whoever's paying you for that. That's who you're
exactly.
going to provide that service for. So doctors are not providing a service to an employer because they don't get paid by an employer. Okay, doctors technically are not providing a service directly to a patient. They're providing a service directly to an insurance carrier, an insurance company. And that might sound really hard, but it's actually true when you get down into the details because doctors are so busy that they have to focus on, and their margins are getting smaller and smaller, especially if you're in primary care.
Mhm.
So doctors have to know, they have to study, they have to have good staff that know what they're going to get reimbursed for. And I didn't say paid for, I said reimbursed because that's the way the money flows in the traditional healthcare model. You know, an individual or a company has um, health insurance. Okay, they pay a premium. So the patient pays the health insurance company and then they go see a doctor. They don't pay the doctor besides their copay, but then the doctor has to file a claim. In other words, a claim like, please pay me for what I've done for this person, you know, and then the insurance company reimburses the doctor for that service. So if a patient needs something that is kind of outside of what is traditionally reimbursed by the insurance company, they're probably not going to do it,
Mhm.
because they're not going to get paid for doing it.
I think that's very eye-opening to a lot of people, what you just shared with us. They always assume that the doctor has all these freedoms and agency, and unfortunately, that's not necessarily the case. And I have heard of situations where protocols and red tape has been more in the way, in between, literally in between the doctor and the patient, instead of helping get the patient to heal and to improve their health, which is ultimately what this is all about. And what you are doing is literally doing away with that middleman, and you establishing a direct relationship towards individuals but also employers. And that is not to say that we think there is no space, no place for health insurance. There is, but it needs to be utilized in the correct way, at least what we perceive to be the correct way. So let me ask you, Dr. Roger, how do you ideally see health insurance contribute to a healthy relationship in this constellation?
That's a great question. And I don't see a big need for insurance in primary care, you
Mm-hmm.
know. So primary care is so affordable, and we prove that every day. Week before last, I went to give testimony at the Capitol in Texas to a special committee, and I told them that I've got all of these folks in my clinic, hundreds and hundreds and hundreds of them, and we have been providing primary care for them that's affordable and accessible, and we've done it without insurance. So I that's why I say that we don't need so much insurance in primary care. We need insurance for the higher level of care.
Mm-hmm. And I know you can prove that. This is not just empty statements.
Right.
You have data and documentation, and I invite anyone, any employer, anyone who is interested in this topic to reach out to you and your team, because you
Right.
will take time to show that and explain it. And I can guarantee you, you will see how that will impact your bottom line, but more importantly, your employees' access
Right.
to high quality healthcare.
Right.
And
And that's what we're really passionate about. That it's not just me, but it's my whole clinic team. We love to provide care like this. We take time with our patients. We help them get connected to the right specialist, get the right procedures, and keep them out of the ER and that kind of thing. So we love providing care this way. It's so refreshing as a doctor to be able to provide this way. And I just wish that more and more people could know about it, and not just know about it, but really experience it. So that's why I'm really thankful to you, Shankar, for taking time out of your travels to connect with me on LinkedIn Live today to help me just get the word out. And hopefully anybody listening today will have a desire to just experience this great feeling of having affordable access to care, whether it's with my clinic or some other direct primary care doc, whatever area they're in. But
mm-hmm.
It's a wonderful thing. I mean, access to a doctor is affordable.
Yeah, and I hope that at the very least we have made our viewers a little bit curious, and they will take promise you, just take 5 minutes, go to the website, directmedclinic.com. It's blended in here in the ticker, and look through the testimonials, look through the data, look through our explanations of how this works for individuals and employers, and reach out. I know that you, Dr. Roger, are all about education and helping. Nobody's gonna be sold anything that they don't want or need. It's all about seeing the value, showing the value, and experiencing the amazing service.
Right.
Do you have anything upcoming that you want to maybe announce, or maybe it's not ready yet to reveal? I'm not sure.
No, probably not ready.
Okay. Well, we'll keep people. This was intentionally generating curiosity here to join our next live. I'm sure within a few days or weeks you'll be ready to announce another project where you help educate. You keep that on really as a priority in what you do, and I appreciate that a lot.
Okay. Well, thank you so much, Shankar. Thanks to everybody for listening today.
Awesome. We'll see you very soon on this channel. Don't forget to comment if you have questions, and bye-bye for now.
Okay. Bye-bye.